Well, welcome everybody to Christ-Centered Chiropractic. We're talking about some really cool stuff today, but before we do that, just want to remind everybody, October 9th, the Mega Growth Conference. It's going to be amazing. Last year, really, of all the conferences we've done, Dr. Rob, we really had this startling results last year. What happened in terms of people since then? It's been about 10 months since that time. The amount of transformations that have occurred for people physically, spiritually, mentally, and the practice growth has been enormous. We've got the same lineup, it's a new, sort of new set of themes and categories, but same lineup. And so, if you come there, you can expect something radical to happen over the course of the next 12 months following. So you don't want to miss it. It's Dr. George Curry, who just has, he's an icon in the profession. He's a legend. Everything he shares, you can take to the bank as to what you can do for the rest of your whole career. Dr. Ray Omid, who's probably the most on fire, fastest growing clinic in chiropractic today. Of course, you got Dr. Rob and I, and we've got two superstars from last year who've blown up since the last year events. Dr. Tony, Dr. Joshua, we're also speaking. So again, October 9th, don't miss it.
Yeah, it's amazing, Dr. Ben, when you hear someone like Dr. Ray, who is getting like 100 new patients a month from having 4 events a month. It's amazing for you that come to the conference. When you hear Dr. Ray speak about how he is doing and able to get 100 new patients a month consistently, and how his practice is literally doubled from 450 a week to 900 a week in such a short time, it's astounding. And our good friend Dr. Curry, who, like you said, Dr. Bennett, is an icon in the profession, also does a lot with the ICA and the pediatric. He's so talented in teaching the philosophy, in teaching chiropractic, about the history of chiropractic and how chiropractic today is the best thing that we can do in healthcare. It's just incredible. And our two superstars from last year, who are just rocking it, who are breaking records consistently every month. It's just amazing. When you come and experience, it's one thing hearing it from Dr. Ben and I and our webinars about how these clients are doing and exploding and expanding. But when you come and you're able to not just hear them speak, but when you're able to fellowship with them, have lunch with them, talk with them, and get some one-on-one conversations with them, I always found, and I know you too, Dr. Ben, going to conferences for so many years, it's great to hear the speakers, but you and I have learned so much at lunchtime and one-on-one, taking people aside and saying, wow, that's incredible, but can you give me some more details about it? And that's coming to a seminar that is going to be just incredible, Dr. Ben.
Yeah, and it's in Connecticut, and I know there's been some troubles up there relative to the restrictions, but they were much worse last year, and we had a great event, so not worried about it at all. Going to be amazing. Kind of wanted to get into one of the topics that we're going to cover, and even just a recent experience that I've had with it. And it's the topic of what we call a day 3 or a day 4. So if you've got a 2-day new patient process, after they've committed to becoming a patient, you call it a day 3. Your process is 3 days, you call it a day 4. What's supposed to happen on that 3rd or 4th day once they've started is if they've really understood chiropractic and they get the mission that you're on, you sit down with them and you talk to them about referring, and not just bringing 1 or 2 people in, but giving us 10, 20 names, 30, 40 names of people we can invite to an event, invite to a dinner, people that they care about, that they know need to get checked, because they've heard the principle. So if they really have gotten it, of course they should be thinking already of who needs to get checked. As we always put it, who doesn't deserve to get checked? Now that you know about the fact that the only way to know if your nervous system is healthy is an x-ray, and the fact that people may be doing something like a dangerous drug or surgery, or they might be just unreasonably at risk because of subluxation, who doesn't deserve to come in here, learn about chiropractic, and get checked? So for me, it's not very hard to get 10, 20 plus names And again, a lot of people like Dr. Ray, for example, he invites them to a dinner and asks to talk to their pastor. So that's where, he gets, as Dr. Rob mentioned, multiple talks a month. A lot of it just comes right from day 3 saying, we also would like to talk to your pastor. So he's speaking in church after church after church. So this becomes this machine. You do a great day 1, great conversion. They understand the principle. They know the mission. You get the names. Next new patient, great conversion. They understand the principle. They know the mission. You get the names as well. It's again, 2 types of names, people that come in and get checked, places to go talk. And it just becomes this machine. And we're going to get into those details more when we get to Connecticut. But I wanted to share one quick story. Now, there's a couple of doctors that I was working with here that are associates of some clients of mine. And the reality is they don't really believe in chiropractic. One specifically said, I don't believe in chiropractic like you do. And when I compare that and the challenges they're having, how few referrals they get, just what's missing in their life and their practice, how little money they're making, just getting by. When I compare that to, like, let's say a Dr. Ray or a Dr. Josh, Dr. Tony, Dr. Curry, Dr. Rob, the people that are speaking there who really believe in chiropractic, it becomes so easy to do this day 3 or day 4. So, we're going to get into the details of pulling off a day 3 or day 4 at the event, but it's going to really start with your belief in chiropractic, your philosophy. Do you get the principle? And if you don't, I guess that's okay right now, but you can't go any further like that. And so once again, get to Connecticut. We'll make sure you're in love, you're passionate about chiropractic.
In today's society with the pandemic, I like to call it the scandemic, but anyway, we're living in a different society. We're living in a culture where people are very, very visual. And in Connecticut, we're going to go over a lot of things in the new culture, in the new season, 2021 blasting off into 2022, and the new season in culture, in healthcare, and chiropractic that we're all involved with right now. But one thing is visual. Now, when I do my group report of findings, I have a big poster, and you've all seen it before. It's a girl. She has braces on. Other companies have put it out. Besides, I think it's Dr. Nikita who did it, and I just have it next to me. Then also to the left of me, when I'm speaking, I have a big poster that I just drew myself of somebody getting vaccinated with a needle and then bending over and not being able to breathe. So here they have the braces, and here they have someone bending over, getting vaccinated, not able to breathe. I don't even mention vaccination. It's just obviously that's what they're looking at. And then I have a patient who got vaccinated, and she came to me before she got vaccinated with asthma, and she was doing great, breathing perfectly, got vaccinated, and now she's having serious breathing problems, even though she's still under care. But she comes to the health talk now for the last 2 months, talking about her experience. She doesn't say whether she should get the shot or not, but she's just talking about her experience about the vaccination. So there's different techniques that we need to use today in culture, in chiropractic, to enlighten the people about the benefits of chiropractic, and more importantly, the need to stay in corrective care. That's why the braces, that when they see braces, it takes 2-3 years, teeth get straight, correction. And then we talk about, and we're going to talk a lot more about this in different talks in Connecticut, but how when the braces are on, 2-3 years, well, when we're dealing with the spine, there's a lot more involved that needs to be corrected. There's vertebrae that need to be on, there's ligaments, there's soft tissue, there's cartilage, there's a lot more involved. So people have an understanding about length of care, they have an understanding about negative effects of vaccination, and they have the understanding about why the need for chiropractic, not just for them, but for every member of their family and for every friend. So there's a lot of things that we're going to be talking about. It's going to be an outstanding event in Connecticut on October 9th. Last year was historic. There was a social distancing, they thought, but as you all know that were there, Dr. Ben and I, and those of you that were there, we put all the chairs together. So we got rid of that real quick. So don't worry about social distancing, because there will be none of that at the Connecticut Mega Growth event. And we're excited about it. We're pumped up about it. And we can't wait for you to be there. Tell your colleagues, bring your teams. It's not just for you, but it's a team event. Lansing last conference, teams are there, practices are exploding, and it's so important that your team also understands the new culture in healthcare, in chiropractic, that 2021 blasting off in 2022 will bring. What a way to finish up the year strong with the event. God bless you all. Remember, with God, all things are possible, and we'll speak to you soon and see you October 9th in Connecticut.